Hi everyone. In this video, let's discuss about the first chapter in surgery from SRB, which is Basic Principles of Surgery. In this chapter, there are only two questions which are very important, like ethics in general surgery and what are the investigations which you do in a patient who is going for a surgery. Let's discuss the first question, which is ethics in general surgery. Here, the most important things what you have to write is doctor-patient relationship, the communication and counseling, and how to break a bad news. Firstly, the doctor-patient relationship. Doctor-patient relationship is the foundation of care between a patient and a doctor. It is based on trust, knowledge, regard, and loyalty. Basically, in a doctor-patient relationship, there are two models which are very important. One is the paternalistic model and one more is the informative model. The paternalistic model and the informative model. Like in a family, the father is the head. Here, paternalistic means the clinician implements what is the best for the patient. Whereas in informative model, the physician provides the patient with relevant informations like what are the risks in surgery, what are the benefits, any alternatives are available, and then asks them, that is the patient and the patient's family, to select any one of them, and then the medical intervention will be followed. The components in a doctor-patient relationship are, you can remember it like A, B, C, D, E or anything like that, like avoid deception, bedside manners, confidentiality, the decision making, empathy, honesty, respect and understanding, and the skills of the doctor. These are like the most important components in a doctor-patient relationship. All these should be present in a doctor who is treating the patient. Other than the doctor's components, the patient also has certain obligations which are proper history, cooperative, compliance, and behavior with the doctor hospital workers. The patient obligations are giving the proper history, being cooperative, compliance of whatever drugs which are being given to the patient, and the behavior with the doctor and hospitals plays an important role. So now we understand what is doctor-patient relationship, which is the foundation of care between the doctor and the patient. Then we understood what are the components and the patient obligations. Also, we know what are the two models in a doctor-patient relationship. One is the paternalistic model and one more is the informative model. That's all you have to write for a doctor-patient relationship. But after this, you can continue the ethics part with regards to communication and counseling. We all know that communication is just mere transmission of information from one person to other. But the counseling part is an extension of communication wherein with the patient, the definitive ideas are exchanged with the patient party to obtain a conclusion regarding the further management. That is, the counseling part is an extension of communication with the patient wherein definitive ideas are exchanged with the patient party to obtain a conclusion regarding the further management. This communication or the counseling part has various aspects. It can be verbal or non-verbal. Verbal means it can be in the form of speaking or writing. In writing, it can be like forming charts or diagrams or any illustrations where you can make the patient understand what he is going through and what are the things we are taking up next, so that the patient will be understanding the concepts even more better and it will ease his brain a little bit at least. And non-verbal like proper body communication, body language, then eye contact and certain gestures which will make the patient feel at ease. This is all about communication and counseling. This is what I already told, like verbal, illustration, diagrams, educational videos, or showing the patients similar patients which the doctor has earlier managed. These are the methods in counseling. There are certain factors which influence communication and counseling, like patient literacy, education, their family backup and their social economic status, the trust and honestness. These are the important factors which influence the counseling part between the doctor and the patient. When you counsel a patient, the patient also has certain rights. Like he can select whatever the doctor says, or he can refuse the doctor or the hospital or the type of treatment which is being given to the patient. Second one is he can have a second opinion. Like he can go to another doctor and also get his suggestions. Reports can also be discussed with other consultants. So these are the patient's rights which he can take up. He can either select the doctor, he can refuse the doctor, or the hospital, or the type of treatment which is being given to him. The stages of counseling. There are certain stages wherein you counsel a patient. Firstly, the doctor has to develop a rapport with the patient, that is client clinician or the doctor patient relationship. After which you will be assessing the patient's problem, the patient's presenting problems, and then you will start counseling the patient and come to certain treatment goals. After that, you will implement those interventions in order to achieve the treatment goals. Then, after treating the patient, after giving certain interventions to the patient, you will call him for follow-up. So these are the 5 important stages of counseling: developing the client-clinician relationship or the doctor-patient relationship, clarifying, assessing the presenting problems, identifying and setting counseling and treatment goals, designing and implementing interventions, planning, termination, and follow-up. This is all about communication and counseling. In this only you can write about breaking bad news. The breaking bad news has been made easy by a model called Spike's model. What is this? Spike's model means setting up an interview, assessing the patient's perception, obtaining the patient's invitation, giving knowledge, addressing the patient's emotion with empathy, strategy, and summary. Let's discuss each one of these. Firstly, in breaking bad news, setting up the interview plays a very important role for the communication between the doctor and the patient. The place where you talk to the patient should be silent or quiet. The environment must be very quiet, and we must give privacy to the patient and the patient party, or the patient and patient's family. And you have to give a dedicated time to the patient. You have to give proper time to the patient. You should not be in a hurry. And first, you along with your team should introduce yourself, and the doctor must inform what his role is there in the team, and make sure that the patient or the family is willing to share all the information regarding to what he is going through. Then assess the patient's perception. That means you should know how much that the patient knows. That is, you should understand how much the patient understands for now, and then you should obtain the patient's invitation. That means you should be a clear listener, an active listener, and you should avoid unwanted or unnecessary interruptions when the patient is speaking. Now the doctor has to give certain knowledge to the patient. The doctor knows what the patient is going through. He knows the medical knowledge. Now, in an easier way, using diagrams, illustrations, and certain videos, the doctor must make the patient understand what is the situation. And after that, when the patient will know all the trouble he's gonna go through in the upcoming days, you should show him certain emotions with empathy, and you should give time for them to express their emotions. At last, you should make a strategy and summarize in total in a short way. This is all about breaking bad news. That is, setting up the interview, assessing the patient's perception, obtaining the patient's invitation, giving knowledge, addressing the patient's emotion with empathy, and strategy and summary. Now, after the communication with the patient, there are certain ways you communicate with the colleagues. In a hospital setup, communicating with the colleagues also plays an important role, which is very crucial to have an effective management of patients. The lack of good communication with the colleagues is the reason for many clinical mistakes. Either it could be a medical negligence, medical error, or medical malpractice. This communication can be in various sites, like in an OT where you communicate with the nursing staff, the anesthetist, and your colleagues. Or when you convey the information when you are giving shifts, or when you are giving certain handovers for the next clinical professional, when you are shifting the shifts in a day-to-day practice, or when the patient is brought to the attention of a critical care outreach team. That is, when you talk to a paramedical staff when you are in an emergency situation. What is this clinical handover? The definition for clinical handover is the exchange between the health professional of information about a patient accompanying either a transfer of control over or a responsibility for the patient. I know this definition is quite very difficult. Just to make it easy, it is just to transfer certain information about the patient's health condition to the staff which will be giving it over in the next half of the day. It is basically a framework called Isabar framework, which involves 5 elements focused on communication: introduction, situation, background, assessment, and recommendation. First, when the next staff in the day comes to you when you're giving your handovers, first you should know who the person is. So you will be asking him, who are you? What is your role in the hospital? What is the patient situation? You will give information about the patient to the doctor or the staff which you will be giving the handovers, like A, B, C, D, E, which is airway, breathing, circulation, deformities, and exposure. What is the patient's oxygen saturation? What is the respiratory rate, heart rate, the blood pressure, the temperature? And you will be giving the information about the background, like when was the date of admission, what was the condition of the patient when he first came to the hospital, and tell about the any allergies present in the patient. Then you will tell about the assessment, whether the patient is stable for now or he is unstable, or what is the next situation, like whether he is going to go for deterioration or the mental status. Then you will recommend certain further investigation and recommend treatment for the patient. So this is all about clinical handovers in a day-to-day practice in a hospital. Again, let me summarize. Isabar framework: introduction, situation, background, and then comes the recommendation. This is all about ethics in general surgery. Let me revise once again. First, you will be talking about the doctor-patient relationship. It is the foundation of care between patient and a doctor. There are 2 models. One is paternalistic model, then comes the informative model. What are the components of a doctor and what are the patient's obligation? Then coming to counseling and communication, the definition of it, the verbal and non-verbal methods, the factors influencing communication and counseling, what are the patient's rights, the stages of counseling, and how to break a bad news using Spike's model, setting up the interview, assessing the patient's perception, obtaining the patient's invitation, giving knowledge, addressing the patient's emotion and empathy, strategy and summary, communication with the colleagues. What is the clinical handover? Now the next question in this chapter is investigations of a surgical patient. For this, you just have to write the pre-op investigations which you will be doing in a patient, but I have made it a little bit vast. That is perioperative care. The perioperative care is just the time lapse surrounding the surgical act. It can be like preoperative, operative, and the post-operative. It is an organized planned work including or involving a big team like the administrative block, the pre-operative assessing team, the nursing staff, the anesthesia team, the surgeon and his team, and the post-op ICU staff. In the pre-operative part, you will be writing about the hospital admission, the pre-operative evaluation. This is what you have to write for the exam, but in case they ask about the perioperative care, you can write it as a whole. So then comes the pre-operative evaluation, the physiotherapy opinion, and the pre-anesthetic checkup. In the hospital admission, the administrative block plays a main role, wherein they'll take the name, his identifications verification, the age, and the admission corresponding unit will be allotted to the patient. In the pre-operative evaluation, it is done by the surgical resident and the main operating surgeon. This is basically taking fitness for the surgery, wherein you take history taking, the general physical examination will be done, the systemic and local examination should be done, then the routine CBC, that is complete blood count, the blood sugar levels, PT, APTT, INR, the liver function test, renal function test, and the cardiology status like ECG and echocardiography, for the pulmonology status like spirometry and chest x-rays, and taking opinions from all the specialists plays an important role in the taking fitness for surgery. Then comes the physiotherapy opinion, then the pre-anesthetic checkup, like for the airway, the cardiac and the respiratory assessment, and if the patient has certain drug allergies should all be noted. After all of these, informed consent is very much important, wherein you tell the patient what is the surgery, the risks, benefits, and what are the other options for surgeries. You will make the patient understand in his own language. It can be in the form of written case sheet or video recorded. Then the second part of the Perioperative care is the operative part, wherein proper planning by the surgeon and his team will be done, selection of an ideal surgical procedure, discussion with the team members and the anesthetist, arranging blood products, proper asepsis should be maintained, discussing with the scrub nurse regarding the instruments, proper anesthesia, intubation, extubation, need for ICU should be discussed with the anesthetist, taking care of the possible on table care, call for help when needed. The post operative part is monitoring the vitals, which is respiratory rate, temperature, heart rate, blood pressure, oxygen saturation, and the level of consciousness. There's something called post anesthesia care unit. It's not the ICU. During the recovery period after a major surgery, many patients need monitoring of their vitals and physiological parameters in an overnight intensive recovery unit. It is not care unit, it's recovery unit. The patient after this PASU, he need not be transferred to the ICU. He might be stable. So PASU is just usually for 24 to 48 hours, wherein his vitals will be monitored for an overnight setup for his recovery. After this, you have to check for complications for the nutrition and fluid therapies, and physiotherapy and early ambulation should be done as soon as possible. This is all about the perioperative care. Let's summarize once again. Perioperative care is just the time lapse surrounding the surgical act. It can be pre-op, operative, and the post-op part, which is done by a huge team including so many staff. The perioperative part has hospital admission, pre-operative evaluation, which is very important for all of you, then physiotherapy opinion, pre-anesthetic checkup, then comes the informed consent, and how is the operative part, and then the post-op. This is all for this chapter. Thank you once again. See you in the next video.